Good day, everyone. Welcome to our rationalization for long test 4, and we talk about nursing practice 5. And this is about professional adjustment, leadership and management, ethics, and research. My assignment is about professional adjustment in nursing and also nursing research. Let's proceed with our first question. Number one, nursing is a profession. Miss Christine is a newly appointed nurse in a hospital in Manila. Her knowledge of nursing's professional development is required in order to project the profession in a way that it lives the standards of nursing. Number one, membership in an accredited professional organization or APO, such as the Philippine Nurses Association, is one of the basic qualifications in the issuance of a certificate of registration. PNA was established in 1, 1922, 2, 1926, 3, with President with Rosario Delgado as first president, 4, with Anastasia Hiron Tupas as first president. Of course, we know that our PNA has been established in 1922, and that is known as the Filipino Nurses Association or the FNA. But after a few years, and they shifted the name into Philippine Nurses Association. And of course, the founder of the institution or the organization is Anastasia Herontupas. She is the founder of the organization, but not the first president. So the best answer for number one is letter A, 1 and 3 only, except number two, because this is actually when the FNA has been shifted to PNA. And then Anastasia Herontupas is the founder, but not the first president. The first president is Rosario Delgado. Number one, the best answer is letter A. Number two, as a National Nurses Association, Philippine Nurses Association, or PNA is characterized as follows, exempt. A, both a professional body and a labor union. B, affiliated with the International Council of Nurses. C, advocating for improved work and life condition of nurses. And D, accrediting body for continuing education program. Of course, part of the responsibility of PNA is to make sure that we are actually updated with our practice as nurses. That's why they actually are considered to be an accredited body, the only IPO, the only accredited professional organization in the Philippines is PNA by, of course, the Professional Regulation Commission. And then we know that PNA is very important because their purpose is to promote the welfare of nurses. So letter C is also correct. And then, of course, we know that PNA is actually uh, an organization that is uh, in contact with other organizations in the world because of the presence or the membership of the International Council of Nurses. We know that the or the code of ethics for Filipino nurses has been crafted because of the basis coming from the International Council of Nurses code of ethics as well. So therefore, BCD are basically a positive statement, but what we're looking for here is a negative statement. We know that it is a professional body, but it does not serve as a labor union. Number two, the answer is letter A. Number three, Benner's proficient nurse level is different from the other levels in nursing expertise in the context of having A, the ability to organize and plan activities, B, having attained an advanced level of education, C, a holistic understanding and perception of the client, or letter D, intuitive and analytical ability in new situations. Of course, we know that Patricia Benner's level of expertise starts with the novice. Of course, we know when you say novice, it means that you are basically capable of doing simple things. And when you say it's actually an advanced beginner, it means that you have attained advanced level of expertise or experience. That's at least 1 year. And at the same time, you have advanced as well your studies. And then, of course, we know that if that is already competent, it means that you are capable of doing complex care. And if that is actually on the proficient, it means that you are focused on having a holistic understanding of the patient. And when it is actually on the expert level, it means that you are capable already of intuition. And at the same time, you have this highly analytical capability. So letter A, ability to organize and plan activities, that is part of the novice. Then attain advanced level of education, that is for advanced beginner. Then letter D is expected to be present for patient or individuals or nurses who belongs already to the expert level. Number three, the best answer is letter C, a holistic understanding and perception of the client. Let's proceed to number four. Who among The following nurses can work as practicing nurses in the Philippines without taking the licensure examination. Of course, there are three mandates in sorry in our Philippine Nursing Act of 2002, which allows nurses to work here in the Philippines without taking the examination anymore. So, is it a internationally well-known foreign nurses or foreign nurse experts, which services are for a fee? Letter B, those foreign nurses that are hired by local hospitals in the country. Letter C, expert foreign nurse clinicians hired by prestigious hospitals. Or letter D, those foreign nurses in medical mission whose services are for free. Of course, letter A and D are actually opposing. So if you are practicing here in the Philippines with a fee, it means that you need to be reporting with the PRC for you to be given your uh, license, or for you to be given your temporary permit. But of course, if that is specific for medical mission, there's no need for you to have licensure examination for that purpose. The best answer for number four is letter D. Five. Vladimir just graduated from college with a degree of Bachelor of Science in Nursing from a recognized college of nursing. He intended to take the integrated comprehensive nurse licensure examination so he can practice his profession after passing the said examination. 5. Which of the following requirements is not needed for Vladimir to qualify for the said examination? A. Must be with a good moral character. B. A Filipino citizen. Letter C. A holder of bachelor's degree in nursing from a college or university that complies with the standards of nursing education duly recognized by the proper government agency. And letter D. A member of the accredited professional organization. Of course, we're looking for here for a wrong answer, not needed. Of course, we know that um, our main requirements before taking the board exam is BCG. No, of course, be a BSN degree holder. Then letter C is a citizen of the Philippines, and then letter G of good moral character. So therefore, A, B, and C are correct, but not including letter D, because you are not yet a professional. Therefore, you should not be a member yet of the PNA. But after passing the board, before you can take the oath of professional allegiance to the profession, you need to be a member of PNA. Letter D is the best answer for number five. Number six, should Vladimir fail in one subject but obtain the required general average, which of the following is required of him to do? Of course, if you got 75% as your average, but you fail in one of the subjects, such as getting less than 60%, what should you do? A. Take the whole set of examination all over again. Letter B. Take the examination on the subject where he is rated below the required passing rate. Letter C. Make an appeal to the Board of Nursing for a rechecking of his examination papers. Or letter D, enroll in a refresher course for 1 year. Of course, we know that enrolling in a refresher course for 1 year, this is required for those who actually is not practicing the profession for the past 5 years, 5 to 10 years. But here, there is actually failure of the board examinations. Here. No need for a refresher course. And then letter C is also wrong because, of course, you cannot contest with the Board of Nursing to have your papers rechecked for your own sake, no? And then, of course, we know also that you will not be taking the entire examination all over again because you will only take the exam to the specific nursing practice with less than 60% of your board rating. And then you need to get 75% for that purpose of retaking that subject. So number six, the answer here is letter B. Take the examination on subject where he is rated below the required passing grade. So you need to get 75% for the second take. For you to get the 75% overall, and you will actually be marked as a conditional passer if you have actually met this standard. Seven is letter B. Six is B. Seven. Upon receiving notification of passing the licensure examination, which of the following is a priority action for Vladimir? A. Take an oath of profession before the Board of Nursing. B. Apply for registration with the Professional Regulation Commission. C. Apply for membership to the Philippine Nurses Association. Or D. Prepare credentials for job hunting. Of course, you're not yet a full-fledged registered nurse if you have not actually gone through specific procedure. Letter D is wrong because you can do job hunting once you have already complied with the requirements by the Professional Regulation Commission. And then applying for membership in a PNA should have to be done once you are done with the registration. And then once you're done with the registration and membership of the PNA, then you will take the oath of profession before the Board of Nursing. But it's only not limited to the Board of Nursing. If ever there are circumstances that you cannot actually take the oath because you are not there during the mass of taking, you can take the oath with a lawyer or any public servant like mayor and other public servant in the country. So number seven, the best answer is you need to apply for registration, and that is letter B. Eight, sorry. Vladimir was issued a certificate of registration by the Board of Nursing, which of the following information should be shown in the certificate. One, full name of the registrant. Two, serial number. Three, signature of the chairperson of the commission and the member of the board. Number four, official seal of the commission. Number five, signature of the president of the accredited professional organization. Of course, we know that uh, your certificate of registration contains your full name. And of course, it has its own serial number, same as when you're receiving a document. It means that that serves as your own specific number. And at the same time, there has to be signature of the chairperson of the Professional Regulation Commission. At the same time, signature of the members of the Board of Nursing, including the chairperson. And it also bears the official seal of the Professional Regulation Commission and at the same time the Board of Nursing. But what is not included there is the signature of the PNA president because they are not directly uh, connected with, they are not going to have the same responsibility with the president of PNA. Therefore, the best answer for number eight is B, 1, 2, 3, 4, except number five. Number nine. Nurse Germain is newly appointed by the local government to lead the program on integrated management of childhood illnesses in the municipality of Valencia. She knows that as a young and inexperienced nurse, she needs to update her competence in the legal aspects of professional practice. Number nine. As a nurse, Germain is at risk for lawsuits. Which of the following actions will shield her from possible lawsuits? Number one, knowledge and implementation of standards or protocol of care. Number two, documentation of actions accurately and concisely. Number three, document outcomes of care. Or number four, following all doctor's order that are legal in writing. Of course, we know that number one is correct because you're trying to practice then your scope of nursing practice. The number two is also very important because documentation is actually serving as a good purpose when it comes to the documentation of care. And of course, when you are doing your NCPs, it's very significant that you're going to have your outcomes of care. So number three is also correct. But what is wrong here is number four because you should not actually carry out all doctor's order because you need to exercise your critical thinking, and at the same time you have to make sure that sound decision making is actually being followed when you are actually following when you are carrying out doctor's order. Therefore, number nine, the best answer is Bravo. That is 1, 2, 3 only. 10. Germaine knows that the fundamental responsibility in her profession is fourfold, which is the most basic for which is the most basic of these responsibilities. A, promote health. B, prevention of illness. C, restoration of health. Or D, alleviation of suffering. So, of course, we know that when you are actually entering the profession, your most significant responsibility that is usually neglected by us is basically on health promotion. So the best answer for number 10 is letter A. That is the core of our profession, health promotion. That's why we need to give health teaching in all aspects that we can do, whether the family or the patient is actually on the primary prevention, secondary prevention, or in the tertiary prevention level. Number 10, the answer here is A. That is promote health. 11. Germaine can act as a professional nurse when she serves as a role model by supporting standards of nursing practice, be working in coordination with other professional groups, see involvement in nursing research, or the counseling and assisting other nurses. Of course, we know that We are acting as a professional nurse if we are following the scope of our nursing practice. Counseling and assisting other nurses, this is the responsibility of a counselor. And then, of course, letter C, that is for nurse researcher. And then letter D, that is actually collaborative practice. What we are focusing here is a more broad answer, which is the umbrella effect of the question that is being asked. The answer here is letter A, because that is going to give us a wider scope, and B, C, D are actually part of it. So number 11, the best answer is letter A. 12. Nurse Germain encountered a situation of a patient who resides in Pasig and was involved in an accident in Quezon City and was brought to the emergency room in a hospital in Makati City. It so happens that the location of the incident is closer to Makati, where the patient was admitted. The patient is in critical condition and dies after a couple of hours despite medical and nursing care. Nurse Germain should know that the death certificate should be furnished where? A. Pasig City, B. Quezon City, C. Makati City, or D. Anywhere where there is a local government unit. Of course, we know that the patient here resides in Pasig City. And then the accident happened in Quezon City. But the patient was brought in Makati City for the hospitalization. But of course, by ruling, it is expected that that when the patient died in that specific location, it means that the certificate of death should have to be filed in that specific area. It should not be filed to where the patient resides. And also, it should not be filed to where the accident happens. Therefore, you should file the medical death certificate in Makati City. The best answer for number 12 is letter C, Makati City. 13. Germain, an experienced nurse, who voluntarily trained a less experienced nurse with the intention of enhancing the skills and knowledge and promoting professional advancement to the nurse is called mentor, team leader, case manager, or change agent. Of course, we know that when you're training someone who is less experienced, then you are a lifelong mentor. Answer here is alpha. 13 is alpha. Not a team leader. When you are a team leader, it means you're leading a specific group of individual. In your case manager, it means you're organizing specific group of care. Then change agent, it means that you are a change maker or you are a trendsetter. So 13, the best answer is alpha. So we're done with the first half of the question. Let's proceed now to nursing research, which is actually the second part of the topics assigned to me. Number 14. Random sampling usually provides a sample that is representative of the population because each member of the population is selected independently and has an equal chance or probability of being included in the study. B, each member of the population is selected dependently and has an equal chance of being included in the study. C, selected members of the population is chosen independently and has an equal chance or probability of being included in the study. Letter C, each member of the population is selected independently and has an equal chance or probability of being included in the study. So, the best answer for number 14, wrong ang letter A because of the word unequal. It should be equal, no? And letter B is also going to be wrong because it is dependently selected. It means there is bias. And then letter C is actually wrong as well because of the word selected. It should be that each member of the population is selected independently and has an equal chance or probability of being included in the study. That is what you call randomization. Because when I say random sampling, it usually provides a sample that is a representative of a population, and then uh, that usually gives each member of the population the independence and also the equal chance of uh, being included in the investigation. So number 14 is letter D. Next number. Sampling is a key element of research methodology. To judge the adequacy of sampling procedure, you need to understand some of the principles of sampling theory. The population eligible for the study to which the researcher has reasonable access is A. Sample, B. Accessible population, C. Universe, or D. control group. Of course, when you are talking, the keyword here is eligible population, population eligible for the study to which the researcher has a reasonable access. So it's not the universe, because when you say universe, it means that you're talking about the entire general population, and you cannot have a reasonable access to that. And it should also not be control group, because control group is present in the sample. So the Q here is population. The best answer for number 15 is letter B, accessible population. Of course, we know that the population eligible for the study to which a researcher has reasonable access is known as the accessible population. That is letter B. 16. In order for each person in the eligible population to have an opportunity for selection in the sample, each person in the population must be identified. A listing of every member of the population must be acquired, and this is referred to as A, sampling plan, B, sampling frame, C, representativeness, or D, randomization. So eliminate diretso yung letter C and D, because that is focused already on the probability sampling. We're not talking about the probability sampling, because when I say probability sampling, it means that you're talking about having randomization and at the same time representativeness. C and D have the same meaning. So it's between A and B. Is it sampling frame or sampling plan? Of course, when you're talking about listing, so if there will be listing, that is already the sampling frame. Because when you're talking about sampling plan, it means that you are still planning to have your inclusion criteria for the selection of the respondents. 16, the best answer is B, sampling frame. Next number. This sampling method can be conducted when an ordered list of all the members of the population is available. Keyword ordered list. The process involves selecting every nth individual on the list randomly. A. Systematic sampling. B. Cluster sampling. C. Simple random sampling. Or D. Quota sampling. Of course, we know quota sampling is a non-probability sampling. So eliminate letter D. When I say simple random sampling, that is your fishbowl method. You are selecting the respondents in the fishbowl. Then we see cluster sampling, it means that is clustering a huge population into segments. But when you say every end, and that is based on an order, that is systematic sampling. Number 17, that is letter A, systematic sampling. Next, number 18. Angela wants to obtain more subjects for study career oriented alcoholic women. She contacts her subjects after word of mouth inquiry at AA club, physical examination centers, fitness centers, and doctors' offices and nursing organizations in the city. She is using A, purposive sampling, B, convenience sampling, C, quota sampling, or D, snowballing. Of course, when you say purposive, it means that there is the established set of criteria. Then letter B, convenience sampling, the focus is that is incidental, or whoever is available during the data gathering, that's gonna be uh, your respondent. Then quota sampling, that is establishing a set of numbers or establishing a target number for the interview or for the data gathering. And that, of course, we know that letter D, snowballing, is focused on networking or linkages. Number 18, the best answer is letter D. That is your snowballing. 18, C. 19. When subjects are selected on the basis of race, ethnicity, personal history like drug abuse and treatment, personal experience with a certain disease or phenomenon, the sampling method being used is purposive sampling, convenience sampling, quota sampling, or snowballing. Of course, we know if that there is already established criteria or select inclusive criteria, that is purposive. So the best answer for number 19 is letter A, purposive sampling. So that is also referred to as judgmental sampling, in which it involves a conscious selection of the researcher of certain subjects that is included in the investigation. Number 19, letter A. Next, number 20. William and his colleagues conducted their study entitled Patients' Perceptions of Nurses' Use of Touch. Their sample of 54 adult patients was selected from the hospitals they are affiliated during their clinical duties. The sampling method used by Williams Group is purposive sampling, B, convenience sampling, C, quota sampling, or D, snowball sampling or snowballing. Of course, we know the keyword here is there were actually 54 adult patients were selected during their clinical duties. It means that that is incidental. Whoever is available during that investigation, it means that they are included in the study because they happen to be in the right place at the same time and the right time of the data gathering. Number 20, the answer is letter B, convenience sampling. 21. This code includes guidelines that will help you evaluate the consent process, the protection of subjects from harm, and the balance of benefits and risk in the study. It was developed as a response to the mistreatment of human subjects in Nazi experiment. Is it Declaration of Helsinki, B, Nuremberg Code, letter C, Patient's Bill of Rights, or letter D, Declaration of Human Rights? Of course, we'll eliminate letter C and D because it's the same. You talk about the rights of the patient. And then, of course, we know that Nuremberg Code is actually uh, done right after, no, Declaration of Helsinki is actually uh, the focus of that one is that was adopted, especially in the World Medical City. It is a document that is differentiating therapeutic research from non-therapeutic research. Therefore, when we talk about your informed consent, the focus of that one is the Nuremberg Code. Number 21, the answer is B, Nuremberg Code. 22. Number 22, that's the answer. That is Declaration of Helsinki because I mentioned about differentiating your therapeutic and non-therapeutic research. That is your Declaration of Helsinki. Again, if you're talking about the informed consent, that is uh, focused on the patient's Nuremberg Code. But if you're talking about the differentiation of your therapeutic and non-therapeutic research, that is your Declaration of Helsinki. 22, that is letter A. 23. Informed consent in research includes which element? One, disclosure to the subject of essential studies information. Number two, comprehension of research information by the subject. Number three, competency to give consent. Number four, voluntarily consent to participate in a study. Number five, benefits obtained from the research. Of course, we know that uh, the focus of the investigation is when the informed consent should have to have disclosure. And then when you are disclosing, it means that you are validating also the comprehension. And number three, important competency to give consent because there's a need for us to the competency to give the consent, and it should have to be following the self-determination or the voluntary consent. And what is strong here is number five because of course it will not give benefit, it will not actually benefit the subject, but it will actually benefit the entire population. Number 23, the best answer is letter C. 1, 2, 3, and 4 only, except number 5. 24. Nurse Flor de Luz assesses whether the patients in her unit involved in a certain clinical research understand the purpose and the potential risk and benefits of their participation in a study. This is her role as patient clinician, patient advocate, patient counselor, or patient therapist. Of course, she is not giving a uh, a counsel or she's not giving an advice. And we know if that is a clinician and a therapist, it's the same. You're working towards the betterment of the patient. The best answer for number 24 is letter B, patient advocate. Of course, we know that as a patient advocate, a nurse needs to assess whether the patients involved in research and understands the purpose, at the same time the potential risk and benefits of their participation in the study. Next, last number. Which of the following is an essential information for consent in nursing research? The researcher states only the short-term goals of the study. B, the researcher describes the benefits to the some of the subjects when asked or reminded. Letter C, non-disclosure of alternatives, or letter D, options to withdraw. Of course, we know that when you're talking about research, A, B, C are basically violation, because you should have to focus on both the short-term and long-term goal, and then of course you will have to describe the benefits even if you're not being asked, and there has to be disclosure. Answer for number 25 is delta, option to withdraw. With that, thank you so much for your time, everyone. Congratulations to those who got good scores.